I guess I gotta sit up, ladies. All right. How's everybody doing? It's me, Lily G, TTC. Y'all look at my face. It's getting super puffy. I feel like my eyes are a little puffy too, so I checked my blood pressure. My legs aren't swollen or anything. But at almost 35 weeks, I'm getting a pregnant full face, so Aunt showed me some pictures of myself. He had like a little picture collage from before pregnancy to when I was 4 weeks and then today. So yeah, this is the current status of my face. It's my nose is about yay big. But anyway, I just came to do a quick update. Let you all know that I am doing well. I will be 35 weeks on Wednesday. Tomorrow is the girls' appointment. They will do their weight check. Somebody just kicked me. They will do their weight check and let me know how they're doing. Everything is pretty much done for the girls. We just put their bassinet together and then put all their supplies underneath. I'm going to be downstairs because my bed is too high. So there's no way I'm going to be able to climb in that bed with a cesarean incision. It's just not going to happen. So the bassinets are together. Their nursery has been done. All their newborn clothes are washed, cleaned. They're all set. So what my prayer is that since they'll be born between 36 and 37 weeks, is that their breathing is okay. They can regulate their temperatures and they feed well, so they won't have to spend a week in the NICU. A lot of babies born at that age can just go home, but those are the markers the doctor wants them to meet in terms of breathing, temperature, and feeding. So I was talking to Aunt today, and you ladies let me know because clearly I've never breastfed before, but I'm gonna try to breastfeed to get the attachment and bonding with the girls, but I'm gonna go to work in 3 months. So I don't know if it's easier to start them off with breast milk in a bottle so I won't have a tough transition when I go back to work. But you ladies who have breastfed, let me know what your experiences are because I honestly don't know. And then today I realized, so I have bottles and I have all these Medela products like the bottles, but none of them had nipples to them. So I just did like an order on Amazon to make sure I have like the nipples to go with all the bottles because I didn't realize none of them were in there, but first time mom stuff. Excuse me. So what else? I'm going to be interested to see what my weight is tomorrow at the doctor because last week it was stable, but I don't feel like my face looked swollen like this. So, anywho, short of breath a little bit. The babies have dropped though. I have that lightening, so I definitely feel a head down in my pelvis, like a little more prominent than it had been. So that's what's going on there. Like I said, I still haven't had any high blood pressures, no diabetes. Overall, quite frankly, I'm just so thankful to God because this has been a miraculous pregnancy. It really has. I mean, I really can't complain because I've done extremely well considering I started the pregnancy overweight. So, you know, the doctors tell you about all the risks. I had monochorionic twins that I didn't know I would even carry them this long, honestly. To be able to get to 36 or 37 weeks is really miraculous. So I just thank God for all that he's been able to do for me. What else? So I told you ladies about the fact that I am going to I'm thinking of getting a midline incision, and the only way I'll do that, I'm going to talk to my doctor tomorrow, is if he will do a low vertical incision, meaning from my belly button or umbilicus on down, because I don't want a classic incision like the kind my mom had to get me out. No, sir. So if he is even thinking of it, like I don't want him to start the surgery and feel like he needs to extend the incision up and extend the incision up in the uterus. So I may have him do the low transverse cut, and I'm just going to have to protect myself in terms of keeping it dry and clean under there in terms of infection. I did talk to one of my colleagues who's an obstetrician about the risk of infection with being overweight, and she sent me some studies, some randomized controlled trials where there were 600 patients, and there's no real statistically significant difference in terms of infection risk with incision type or obese versus non-obese patients. So she said a lot of time incision types are based on surgeon's preference, because obviously she does surgery. So I'm going to be very clear with him tomorrow. If he plans on giving me a classic incision, he's just going to have to cut me under this piece of fat and get these babies out. So I would like the low transverse one or the low vertical. Neither one of those would bother me, honestly. So what else? Other than that, I have my hospital bag packed, my diaper backpack for the girls. And the reason I didn't do a video, because you guys have seen a million of them. And it's the same stuff: breast pads, nursing bras, large underwear, nightgowns, that kind of stuff. In the girls' bags, I do have the cutest comb and brush with their name on them. And then I have hats with their names on them. And then I have some gowns with their names on them, because I watched all these twin C-section videos and they just have A and B written on the baby's caps. So we're coming in there with names, girls. So anyway, I wanted to show you all the cutest little books. So you can get these books. I saw them online. Somebody sent it to me. I think I saw it in one of the pregnancy groups I was in. But there's Princess Naomi, and there's Nyla and the Magic Shoes. So there's their little personalized books. I already read them to them. So, yep. So anyway, ladies, this video is getting too long. Just wanted to let you know that tomorrow is their doctor's appointment. Wednesday is 35 weeks, and they'll be delivered between 36 and 37. So let's see if I can get you a bump shot. I'm in their room, and whoo, Charlie, y'all see it? Woo. So now they're calling them the superior and inferior babies instead of baby A and baby B, because they're on top of each other again. Breech, they were both head down. So these girls are doing what they want to do. All right, video is getting long. Bye.